get you back to the Southfield Health Department now, where officials are reporting a case of measles in Oakland County. Let's listen into this press conference.
Onset of measles, we look at the contagious period, the infectious period of a measles case by the date of the onset of their rash. So that's why I mentioned that date that the rash started on 3/7, because someone with measles is contagious 4 days before the rash starts until 4 days after that rash starts. So for this case, we're looking at a period of infectiousness as 3/3 through 3/11. Remember that measles is one of our most contagious diseases, with virus spread through infectious droplets, and it's airborne as well through coughing, sneezing, singing, talking. You're familiar with all of those routes of transmission from COVID. And so I mention this because also the measles virus can live in the air for up to 2 hours after the case has left the area. I'm just putting this all together so I can give you the list of locations where this person was during their period of infectiousness. So just keep that in mind. So on 3/7, as I was saying, the rash began. On 3/8, they sought care at Henry Ford Rochester's emergency department. And on 3/10, they returned to the same ED where they were admitted overnight and discharged home on 3/11. So our timeline only includes one restaurant, Cruz and Muir on Main Street in Rochester, on March 7th between 5:30 and 9:30 p.m. And honestly, we got very lucky because the only other exposures are those 2 visits to the emergency room. It's very unusual in a measles case.
Can you repeat that one?
Absolutely. Cruz and Muir on Main in Rochester on March 7th, from 5:30 to 9:30 p.m. And then our other 2 potential locations for exposure are Henry Ford Rochester Emergency Department, that's at 1101 West University Drive in Rochester, on March 8th from 3:40 a.m. to March 9th at 9:32 a.m. and March 11th, 8:30 a.m. to 5:18 p.m. These details will come out in the press release so that you have all these dates and times secured. The reason that we want to make sure we're highlighting these locations to the public is because, as I mentioned before, measles stays airborne for 2 hours and it's highly infectious to those individuals who are not vaccinated. And so we really want the public to know, if you were at Cruz and Muir on the 3rd, we need you to be on the lookout for symptoms. Early symptoms of measles start with a fever, and it can be a very high fever, 105 degrees sometimes, a very dramatically high fever. And the classic symptoms are a runny nose and pink eye, conjunctivitis. So we're really looking for you to be watchful of those symptoms if you were at the restaurant or at the hospital emergency rooms during those times. And my request to the public, please do not go to the emergency room if you have these symptoms without calling first. We need you to notify your healthcare provider so they can put the proper isolation precautions in place so they can protect the public and all of the other patients that would be in that facility. Because again, measles is highly infectious. Let's talk about vaccination. So the measles vaccine is highly effective. 97% after 2 doses. It's an incredible vaccine, and it's one of the few that works post-exposure. If you can vaccinate someone within 72 hours of exposure to a measles case, you can prevent their infection or reduce the severity of their infection. With this timeline, there won't be anybody in that 72-hour window for vaccine, post-exposure prophylaxis. But there is another tool in our clinical toolbox. It's called immune globulin. It's a medication that contains antibodies that can also help prevent infection or reduce the severity of the disease. And the window of time for immune globulin is 6 days. So for the people that could have possibly been exposed on March 8th or 10th and 11th at the Rochester emergency room, this immune globulin could be an option for infants that are too young to be vaccinated, so 12 months and under that haven't been vaccinated yet, or adults that are immune compromised. And so I'm urging the public, if you think that you were exposed at any of these locations and have a condition that might create a weaker immune system, please reach out to your healthcare provider to see if you're eligible for immune globulin or IG. Okay, I'm going to talk about the vaccine one more time because I am a public health nurse and vaccines are core to what we do. Remember, to be considered up to date on MMR vaccine, it's typically 2 doses. Children are vaccinated at 12 months and 4 years. That's the typical schedule. And adults that were born before or after 1989 should have these 2 doses. If you were born before 1989, you probably only have 1 dose of MMR. And if you were born in 1957 or earlier, you never got one, but you're considered immune. So we do get a lot of questions about adults that have only had 1 dose of MMR, and I'd like to address that now. Do you need a booster? Possibly yes. So we typically say if you work in healthcare, if you travel a lot, if you have some possible exposure to measles, and you're an adult that only has 1 dose on board, it would be a great idea to get a second. And as cases are increasing nationwide, worldwide, we will start to see more in our community. Think about getting that booster dose. If you could be someone that only has 1 dose, an adult with 1 dose on board, it could be time to get that second dose.